Chapter 8. Olabisi apologizes to her father for the embarrassment and shame, for the discovery that she is no longer a virgin and she had been involved in sexual activity. But Adejon takes the blame. He blames himself for trying to play the roles of father and mother. Although he is not happy with what she has done, he still loves her. He tells Olabisi that from then on, she will not listen to do as I say, but learn from watching, which is an indication that Ade wants to change. Oya walks in and suggests that Olabisi sees a gynecologist to make sure that she's okay. The fear of her being pregnant pushes her to vomit violently in the toilet. The case resumes in a jam-packed courtroom the next Monday with Dr. Asiatu Kuroma as witness. She's a doctor who had examined Olabisi, and she has written many books and articles on female genital mutilation. She describes the process of female circumcision in court, citing that Bondo women consider the clitoris as a dirty part of the body, of the woman's body, that renders her immoral. In Sierra Leone, the clitoris is cut off completely. In other parts of Africa, the vaginal lips are scraped with a blade and sewn together, leaving only a small opening for urinating. She also tells the court that the instruments used are not sterilized, and most Digbasowes do not have any knowledge about germs. In Sierra Leone, the instruments are not sterilized, and the young girls can be infected by diseases such as HIV and AIDS. In addition, the sewers do not administer anesthesia to calm the pain. Some young girls die in the process if a blood vessel is ruptured due to overbleeding. There are deaths, but these deaths are not reported because the sewers are very powerful and believed to have magical powers. Consequently, the community protects them, and the Bondo women take an oath of secrecy. Even when the girls die due to excessive bleeding, it is attributed to witchcraft or the inability to survive the Bondo spirits. In the case of difficult delivery, it is either attributed to witchcraft or adultery. The woman is forced to confess to adultery or infidelity. Dr. Kuroma pronounces that after examining Olabisi, she does not see any medical reason why she should undergo circumcision. During the cross-examination from Salam Sise, Dr. Kuroma tells the court that she had been circumcised as a young girl. She had not suffered any effect from her circumcision. She is a proud mother of a girl of 13. Unfortunately, although she will be celebrating her birthday that Thursday, she's dying from AIDS, which she had contracted in a Bondo camp during her circumcision. Although Sise wants to insinuate that Umu might have contracted the disease through any other means, Dr. Kuroma tells the court emphatically that her daughter is still a virgin and she had actually contracted HIV through circumcision. Ade Jones accepts the apology of the waywardness and takes the blame out of the events that had taken place in court, highlighting love. Oya's suggestion that Olabisi be examined by a gynecologist also stems from the love that she has for the young girl. There is irony that Dr. Kuroma is circumcised without any complication, yet her daughter is a victim of circumstance as she contracts HIV during the process. This situation also brings out pathos, especially as the child is on her dying bed. The health hazards and risks involving female circumcision are clearly outlined by Dr. Kuroma in court. Lastly, take note of the strong belief in tradition and superstition, as the Digbasowe is believed to have magical powers, and those who die for one reason or one complication or the other, the cause of their death is attributed to witchcraft.